All right, so I'm going to walk through how you can solve this problem. And so first you need to decide what your population is. So looking at this test, it's 150 patients with confirmed anterior instability. So this is 150 people who you know have the diagnosis. So therefore we can only look at sensitivity because sensitivity is the ability to correctly identify those people who have the disease with a positive test. We can't calculate specificity because we're not looking at anybody who does not have the test. We have 150 people here with confirmed anterior instability. So those are the true positives that we're hoping to get. We're hoping if we have a very high sensitive test that we're going to get 150 true positives here and zero false negatives. So as we continue reading through our test, of the 150 people, again, who have the diagnosis, 140 of them report pain and subsequent reduction of symptoms following a posterior force, which means that it is a positive test. Given the description of the test in the previous couple sentences up at the top, this is a positive test, and I'll be sure to tell you what a positive test means and what a negative test means. When you're reading about different tests, you need to deduce, you need to understand what a positive test is and what a negative test is. But I'll be sure to make sure that that's clear. So 140 people have positive tests with the pathology. So you have 150 people with pathology, 140 of them have positive tests. Those are your true positive. That goes here. 10 of them report no pain whatsoever, meaning that they have a negative test, but we know that they actually do have the pathology. So this is a negative test even though you have a pathology, which means you have a false negative. You can't calculate specificity here. So you cannot calculate the specificity of the test again because we are not looking at those patients who do not have the pathology and have a negative test. We're looking at the people who do have a pathology and do have a positive test. So if we plug this into our chart here, we said 140 people have instability with a positive test, and 10 people have instability but have a negative test. Those are our false negatives. And then again, going back to our calculation up here, it's simply 140 divided by 150 because it's the true positives plus the false negatives, which gives us 0.933. So the sensitivity we know means that a high sensitivity would mean that if we get a negative test that we do not have the pathology. And the reason why we can say that here is because these would be our negative tests, and you can see that we only have 10 false negatives, which is pretty good. We have 140 true positives and only 10 false negatives. So we can say that if we get a negative test, that there is a small chance that we are getting a false negative. Therefore, if we get a negative result, then we can say pretty confidently that we do in fact have we do not in fact have instability because this number is pretty high. Because we have a highly sensitive test, a negative result means that we do not have the test. However, we can't say that if we have a positive result, we do have anterior instability because of this next part. So here we're looking at calculating our specificity. We said before that we can't look at specificity because we only had a population who has the instability. Now we have a population, 150 people without anterior instability, that we ran this test because we want to check the specificity. So we can look at the specificity here. We have 150 people without anterior instability, and 149 of them tested positive. So we have 150 people who don't have the pathology, and 149 of them got a positive test, and only one tested negative. So if you have a test that is falsely identifying people with the pathology, so it's the test is saying that these people have the pathology when they don't, you're going to have a very poorly specific test, because down in your chart you're going to have 149 people with the positive test who don't have instability, and then one person with a negative test who does not have instability. And if you remember, these right here are our false positives. So we have 149 people down here with a false positives. So this number right here is going to be 149. And this number up here is only going to be 1. So if we calculate that, it's going to be 1 divided by 150, and we get something really, really small, 0.00666 or 0.007, which is a very, very, very small. I mean, it's basically useless. Therefore, this test does not have very good specificity. Therefore, if you get a positive test, you can't say that you cannot say that you are confident that this patient has anterior instability. And that should make sense, because look at this right here. Here's positive test. Sure, we correctly identified everybody who does have instability, but we falsely identified everybody who does not have instability as having the pathology. And that's why you can't say, just because you have good sensitivity, just because, yeah, I was really good at giving positive tests to everybody who does have the pathology, that doesn't matter, because if I look at positive tests across the board, I have to consider my specificity, and my specificity has a ton of false positives. And again, that's why you can't say, just because your test is highly sensitive, if you get a positive test, you do have the pathology. You can only say, if a test is very sensitive, that if you get a negative result, then you do not have the pathology. And then with specificity, now we can switch the numbers a little bit. So again, we have these stay the same. So this is 140 and this is 10. Now if we take 150 people, those same 150 people without the instability, so now we can't calculate sensitivity, we're going to calculate specificity again right here. We're going to take those 150 people without instability, and we revamped our test and we made it better, and 149 of them now tested negative, meaning that they don't have pain, and one of them tested positive. Well, if we go back to this slide, all we did was switch here. We have 149 people without instability who tested negatively. So our true negatives now are 149, which is really good. And our false positives are now only 1. And then if we calculate that out again, we get something, let's see, 149 divided by 150, 0.993. And so now that we have a test that is highly specific, we can say that if you get a positive result, then you likely do have the pathology, because the false positives are so low. Because this number up here is so low, and it's a reflection of very, very highly specific tests, that if you do have a positive test, you in fact likely do have the pathology. So hopefully that clarifies things a little bit. You have to make sure that you have a sensitivity, you have a highly sensitive and a highly specific test before you make diagnoses. So you really want to try to have both of these numbers very high. If only one number is very high, then you have to be careful about what you're saying, depending on what your outcome is. We could do the same exact thing, and I'd suggest switching these numbers around and seeing what it does. Or, like I said, write your own question. I think there are a couple up on the LMS right now. Write your own question and see how these numbers change, and then more importantly, articulate what that means in terms of if you get a positive test